is very critical. I think one of the hard things for us is that we may not always have answers, and by the nature of all of us up here, I think we want to be fixers, and sometimes we don't have a quick fix, but we will certainly be part of the team that moves everybody in the right direction.
That's actually a healthy thing to realize, that there isn't a quick fix to some things. And for example, a topic you might hear a little bit about soon, bullying. Kids sometimes want you not to fix the bullying, not to rush to the school and get the bully in trouble, but to slow down and listen and understand and take the story seriously. Sometimes kids tell me that. Speaking of the school setting, continuing on the topic of stress to some extent, Brittany's going to talk about ways in which possible stress at the school is managed at her school, Cornerstone.
So I'm Brittany Grimshaw. I am the Behavior Support Specialist at Cornerstone Elementary here in Worcester. And so I work primarily with elementary age students. We are in a K-4 building. So one of the tricky things about young kids is they don't say I'm anxious or I have anxiety or I'm stressed. They don't typically use those terms. So sometimes as a school team, we're kind of playing detective a little bit and trying to kind of watch and pick up on patterns and try to get some data that might clue us into what's really causing some of the behaviors. A lot of times the stress or anxiety in young kids comes out in behavior issues at school. So we try to keep an eye on that if we notice that it's always happening at the same time, or if it's always on a Monday when they're coming back to school from the weekend or something like that. We might be able to start putting in some interventions. We try to take a pretty proactive approach to some of the behaviors that happen at school. I have a couple things I'll share and can pass around, but for anxiety, we do a lot of like visual schedules for kiddos so that they can kind of see this is what my morning is going to look like. So this is a to-do side and this is an all-done side. So they come in, it's calendar time. Once it's done, they pull it off and move it to the other side. They know reading comes next. So that kind of reduces some of that anxiety about what's coming next in my day. And then this is just a first then board. And so maybe if the whole day or morning is a little bit overwhelming, we can break it down into like one task at a time. So first we do spelling, then you go to lunch. So the kids aren't worried about what am I going to do after this, what's coming up. So they can really focus on the task at hand. So those are just some examples of visual schedules. I can kind of pass those around if you want to look at them. Another thing we have started is being intentional about creating some break areas, either in the classroom or outside of the classroom. At Cornerstone, we have a break room where we just have some kind of free activities. If a kiddo is feeling stressed or overwhelmed, we encourage them to kind of verbalize that in a healthy way rather than acting out, to be able to say, I need a break. And so they can access that room to just kind of take a few minutes to decompress and breathe and get back on track. And kids have to sit for a long time now, some of them in school, and some are okay with that, and some kids just need a few minutes to kind of get up and move and take a little break. So we do have a separate room for that at Cornerstone. Some breaks are scheduled throughout the day for kids. So if the transition back into the classroom is overwhelming, if that creates some stress, we can kind of schedule a break in there to help with some of that. Maybe after recess, they need time to kind of calm back down. We also have been working with some teachers to set up break areas within the classroom. We want the kids in class, obviously, rather than pulled outside of class. So some teachers have just set those areas up right inside of their rooms. They have some sensory bins that kids can pick things from that might be calming for them. This is just a picture I can kind of hold up of what, like a sensory tent, we call it, a little break area within the classroom. This one is in more of a resource room setting, and this one was actually in a general education 3rd grade classroom. So we are trying to help kids use come up with it on their own. That I'm starting to feel overwhelmed to recognize that and then be able to ask for breaks. We don't generally talk about anxiety necessarily, but we say things about maybe being worried or nervous or scared. Those terms seem a little bit more relatable for younger kiddos. We also have a couple tools that I brought in that sometimes kids can take to class with them. These are just some little gel shapes. Sometimes it gives kids just something to kind of do with their hands while they're sitting. So if they're feeling stressed, it's kind of like the replacement, I guess, for a stress ball that some adults might like to use.
To model this, I think this needs to be passed around the
Okay. They are kind of nice. They are pretty calming. I like them. Yeah. So sometimes the teachers take them too. And then this is pretty cool. We got this year. This is called Crazy Erin's Thinking Putty. We ordered it online, but every classroom has one of these, and it's just a small thing of putty that kids can kind of use. It doesn't make quite as much of a mess, so they're able to take it with them to class to help during some of those stressful moments. So we've also been working on getting mindfulness in the building, which is what she was talking about earlier. Cornerstone, our 2nd graders piloted the program. It's called Inner Explorer this year, and we're going building wide with it next year. I know Melrose Elementary here in Worcester uses it as well, and I'm sure other schools do too, but it's just kind of a 5 to 10 minute program in the morning that kids can use to just kind of clear their minds. It focuses a lot on positive thinking, getting kids kind of centered and calm and ready to start the day.
Now, when you said that kids don't come to school saying, I feel anxiety, one of the things you as parents can do is, in your support of their language development, to continue to narrate the emotions that you are experiencing and that they're experiencing. We often do that when they're little, like, oh, daddy's changing your diaper now. Oh, you grabbed daddy's beard, that kind of hurts. You can continue to teach them language as they get older by teaching them the word anxiety. I find it very useful for young kids to teach them the word frustration. Even though it's a long word, it's what they're often feeling sometimes when they're stacking the blocks, they tip over and they throw them at the cat. So, and that goes for your feelings too. If your kid says, what's wrong? And you say, I'm fine. The kids learn a strange definition of the word fine, or they learn that you're a liar. I'd rather recommend that you say, I'm stressed, but I'm going to go to the other room for a moment and calm down, and then I'll come back and work on dinner. There, you just taught them to name an emotion, you taught them a coping strategy. So that language development continues with the naming of feelings when the kid's experiencing them and when you're experiencing them. And that will help kids be able to come to school saying, I'm overwhelmed or I'm frustrated. And when your kids become teenagers, for them to be able to say, I'm disappointed, I'm frustrated, rather than just slamming doors. So that goes for anxiety and with other things. Thanks. Now we have other school people here to talk about, we talk about stress so far, but sometimes things get beyond just preventing stress and other issues may come up. And let you guys talk about that.
Okay. Well, again, I'm Ashley. I'm with Tri-County ESC, and this is Nicole.
I'm Nicole Shannon. I'm the other preschool school psychologist. Combined, we have quite an array of a background. I have some experience in clinical with a pediatric psychologist through Akron Children's Hospital. as well as working in a preschool program and kindergarten program specifically geared towards children that have some identified social-emotional behavior disorders, and also a K through 12 setting.
In my more clinical setting was with university hospitals with a neuropsychologist that does focus on autism. And as a graduate student, I worked at the Monarch School in Cleveland for children with autism, so I have a little bit more background in that area. And so...
And you've worked with older kids as well.
Yes.
So if there's questions about, from that perspective about older kids.
Yes, right now we are primary preschool psychologists, but we definitely have the background K through 12, so we can answer any of those questions as well. And I think we'll start, and I'll just give a little background. Nicole and I work in the same office, and we slightly share a brain, so we kind of bounce off of each other, so that's kind of how we're going to do this. And a lot of the things that we had kind of thought about talking about have already kind of been covered with some of the things that we're looking for those signs of stress. In the school setting, we're really looking for that consistency. If you're seeing those same things at home that we're seeing at school, that is one of those bigger triggers for us that, you know, we really need to get something in place and to monitor that and possibly make that referral to an outside source. You know, sometimes if we have behaviors that are maybe only occurring, you know, as Brittany said, in one certain environment, it might be more beneficial to look at that environment and how we can change that versus the child themselves, because it may be something that's being put onto them that we need to look at. And so a lot of the things, you know, that we look for are some of those, you know, frequently asking those what if questions, really, you know, wanting to know what if this happens, what if, you know, avoiding things, that constant reassurance that they're seeking from parents or other caregivers. Any of those changes, like that said, with the, you know, the characteristics, if you're starting to see, you know, out of characteristic behaviors, that's going to be a sign to you that something's going on that's a little more significant. You know, one thing that as school psychologists that we deal with is that reluctance sometimes to go to school. And I think, you know, we see that and people automatically say that's a school phobia. And I think the first thing that we need to do when we have a child who's refusing to go to school or avoiding school is really look at, you know, getting at the root of that cause, because it could be a variety of reasons. And while we may think we know the answer, really having that in-depth conversation with the child and the parents is going to be extremely beneficial in finding out what's causing that anxiety and what's causing that reluctance to go to school. And, you know, when you're going along those same routes, you know, talking and resolving any legitimate concerns that they have. You know, sometimes we think it's all, you know, we kind of touched on this already, but we sometimes think that it's all just, oh, you know, it's okay, just go to school, you'll be fine, when there might really be something that they legitimately have a concern with, and working through that with them can be very helpful. And, you know, I am so excited to have physicians on the panel as well, because I think that is a huge component. If we can really have, you know, the parents, the physicians, and the school on the same page, it's going to be so helpful for everyone. And I think just having that consistency has been so helpful in the school to have that input from physicians as well and just cover all of our bases.
We enjoy it as well. It makes it, yeah, that camaraderie and that communication back and forth is so key to successfulness.
And it's, I'm sorry, go ahead.
I just, at school, we've started in a lot of parent meetings asking parents if we, as a school, would have their permission to speak with the pediatrician as well, because it's helpful if we can share any documentation or observations that we have, and we can just fax it right over to the doctor's office. If you let us know, hey, they have an appointment coming up, that kind of takes some pressure off you as the parent to have to remember to bring everything. A lot of times the school can help with that communication piece as well. So, you know, we do have to have your permission as a parent or guardian to be able to do that, but it's been helpful for us to be able to communicate that.
Let's see. Some of the things that if you come into the school setting and you have concerns with behavior, some of the things that some parents who have already gone through the process may have experienced are things like those standardized assessments. You know, we have to try and get we have to get as much information as possible, so you may be asked to complete things that are going to ask a lot of questions, some that may seem completely separate from your child and maybe way out in left field. But it just helps us to get a better picture of where the child is, what are those significant areas that they're struggling with, and what are those areas that they're doing well in, so that we can really provide overarching services to them.
And taking a really quick step back, if we do end up going through the referral process, one of the very first questions that's asked is, have there been any changes within the home environment or within the child's general environment? That way we can take those factors into account, because if there's been a recent birth of a sibling or a move or a change of divorce or a change of the parent's employment status, those are all factors that being aware of can help us as we try to help parents and families work through the process.
And that's a perfect segue into one of the other things that, when Jim and I were talking about, what I would talk about and what Nicole and I would talk about on this panel, one of the things we talked about is, how do we encourage parents? And being a parent myself, I have a 2-year-old, and so I think we always need to talk about, really exposing our kids to as much as we can, even if it's scary to them at first, and I'm the same way, you'll see me Carrie talk. I see myself with my 2-year-old on the playground, and I try not to be that mom who's like, oh my gosh, stay away from the slide, come over here. Because the more I let her do, even if it scares me and maybe scares her initially, the more apt she's gonna be to try those things later on that are scary for her. And I think as a mom and as a psychologist, one of the things that I look at is really trying to know my own triggers, the things that make me nervous for her, the things that, make me anxious, so that, if mommy's having a moment where something is scary, like Jim said, talking about it and just saying, even if it's something as silly as, you have a fear of spiders and there's a spider around, not projecting that onto your child, because even if you don't think too much about it and it's just a natural response, it's something that we want to let them experience and we want to let them make their own conclusions about. And I think that's something that, I'll be honest, was easier to say when I didn't have my own daughter and my own issues that I deal with. So I think that's one of the things that we like to encourage our parents, especially at the preschool level, because, making that transition into preschool is very scary for everybody. And so just, being as encouraging as possible, and really, if they have fears, just talking about them and really showing them that, we'll work through it. And like Jim said, maybe it's not going to be the easiest thing, but we'll get through it, and this is how we'll do it. So I think that's always really helpful.
And I will say, listening to Jim mention, giving children words to express their emotions. There's actually a book that I read to my children that I received from my sister, and it's called Today I Feel Silly and Other Moods That Make My Day. It's actually written by Jamie Lee Curtis, and it's a great book because it takes you through all of these different scenarios with this little girl, and she starts off with Today I Feel Silly, Today I Feel Mad, and it goes through why. And there's this one page that talks about, today I feel strange, mom saying that I might have a brother, I'm not sure I'm happy, and takes you through some of those experiences that children in their, as they're growing and developing, may go through in their day-to-day, and gives them words to describe how they're feeling, instead of just sitting there going, I feel something, I don't know what it is, I don't know what I need. This book really helps them go through, and at the end it even gives them a wheel with the girl's face where they can turn and change the way the eyes look and the way the mouth looks, so that way they can kind of create the faces so that they can associate those faces with those emotions. So as I've been working with my own daughter in her emotional development, I found that book to be very helpful.
And I see, Jim has a stack of books here. I think that's one thing we always recommend too, rather than, especially with younger children, rather than having some of those big in-depth conversations all the time, using those books is fantastic. I actually kind of reached out to some other school psychologists and just asked, what are some books that you found helpful in working with this topic? And one that came up consistently is called Don't Feed the Worry Bug. And that was one that a fellow psychologist said that she uses not only with her students, but with her own children. And things like what to do when you worry too much. And just some of those books that help to take some of that pressure off, and just let you have, that time with your child when you're already sitting at home and reading those books at night before bed, maybe working on some of those things that just help to give them, like Nicole said, the words to express how they're feeling.
I want to interrupt. We're starting to get some questions. I want to first say Barb Landers of the Children's Department has a whole lot of books over there, as well as out there, all cross-referencing some of the topics that you are, some wonderful nighttime, daytime stories. We are getting a couple, and you've all indicated that you work not just with preschool, but all the way to 12th grade. And one is, as a parent of a high-achieving student who struggles with anxiety and panic, what are some of the coping skills I can share with my high schooler, and how can we avoid medication? We haven't talked medication. I don't know if this is the appropriate time, but it seemed like across the table, we might look at that for a moment. I'll do another question after that. Thank you.
Can I jump in on that one? I
Yes.
haven't had a turn yet, but I'm Eunice, occupational therapist, and one of the areas of my specialty is in sensory processing or sensory integration. And the primary component behind that philosophy is that we are sensory beings. We respond to the world with sensory experiences. And so when I look at this, a 12th grader who is dealing with stress, what my response is to say, what can I do physically to decrease stress? And with a 12th grader, it's kind of finding that area of interest. My oldest son, when he was in college, started developing high blood pressure just because of the stress of college. He responded by becoming a weightlifter, by becoming physically active with his world, and beating up on a box, jumping and weightlifting, decreased the stress, brought the high blood pressure down. He's never taken any medication for it. My daughter, when she was in college, in order to focus, was a finger fidget. She could drive people crazy with all of her manipulation of objects. She would make noise with her keys and change and all that stuff. My goal with her was to send her care packages with quiet finger fidgets, so her classmates and roommates didn't get stressed out. So when I'm looking at a 12th grader, that's what I'm thinking about. What are tools available in our community that he or she can get involved in? Is it time to get an outlet? Do you need a physical manipulation? Do I need to learn how to knit? Do I need to learn how to dance? Do I need to learn how to do CrossFit? Can I be a runner? There was another family that their child did stress out over school, but as soon as he got involved with cross country, the stress went away and he became physically engaged in school and was quite successful and now is finishing his freshman year in college. That's how I look at that.
It's interesting to see how our ears pick up different things, because
Yeah.
I heard the words high achieving. That caught my attention. And what can sometimes happen with kids who are seen by their parents and their school districts as high achieving is they feel that's a standard that they need to keep reaching. And they feel that's what they're valued for, is high achieving, and whether they're going to be able to continue to maintain that standard. And of course, 12th grade with college approaching is a transition point. Is that going to be what college is about? Is more of this, I've been on this track to achieve well to get into college, what happens next? Or maybe it's not going to be about high achieving, what is college going to be about then? I don't know what else to do. Now, I'm not saying this is true of your child, but that's, when you put that word in there, that caught my attention, is that maybe not necessarily perfectionism, but just a pressure on yourself to maintain that reputation or to be valued that way. So what to do about that is to find opportunities for the child to not be perfect at something, and to show that you value them, you value their effort, you value their interest, you value time when they tried something they weren't good at and didn't do well at it. And you admire them for trying it, and even something that they weren't sure if they're going to do well at. That's a sort of preventive thing that comes to my mind.
One basic yoga principle is detachment, and kind of the idea that I am not my achievements, I am not my what I produce, and not being attached to results. So working through some mindfulness and some yoga exercises to find that detachment, acknowledgement, but detachment from results can be helpful as well.
Anything about medications, anxiety? I mean, I'm just.
Yes, I was waiting until everybody else had their moment, because, I think that once again, we know that both with anxiety and with depression, that certainly incorporating a lot of the therapies of mental health are really important. My goal is never to put kids on medicine unless they need it. And there are lots of ways that we can decide if and when medication is important. I certainly think there are some kids that get stuck, and medication is a really, really wonderful tool to help them continue to move forward with their therapy. And certainly continuing to engage with the therapist and myself and the family. Just like with school issues, it's really important to continue to get that sort of feedback. What's working, what isn't working, because, I certainly have some kids that I've worked with therapists for a while, and they're good with their therapy right now, but just a little bit of medication helps them stay in a very good spot. Being able to function really well at school, being able to function very well in their home and within their family. So, I think it's important to remember that it's not just medicine by itself, but therapy as a whole, and sometimes medication is part of that. I think that, just as I'm sure was discussed with a lot of the other forums, is, we have the internet now, for good or for bad. And I'm sure that you can find just about anything to support your cause on the internet. And I really would encourage people to seek, instead of anecdotal experiences, to make sure that they choose to look at valid websites and to use things like the American Academy of Pediatrics. AAP.org is wonderful. The American Psychiatric Association, APA.org.
Do you think WebMD is reputable? That's going to pop up in a lot of your searches. So.
Right. I think that once again, while it may be helpful for definitions or for a brief overview, I don't think they're necessarily the best source.
It's not studies. It's not.
Right. And I certainly think that one person's experience is not going to be a blanket response for the rest of the family. We had talked a little bit about this. One of the things that I oftentimes hear from parents is that, we want to do things naturally. I'm all for natural, I am. But in this day and age, vitamins and natural means that they're not FDA approved. And so it is a wide open market of things that can say that it is going to fix something, but doesn't have the studies behind it, nor the safety studies behind it to show that it's going to be effective. So I think it's very important to talk about that with your doctor, with your therapist, what you're taking, because sometimes natural medicines can definitely make an impact on any sort of therapy that we are trying.
And on the topic of avoiding medicine, as a psychotherapist, I once had the view that the psychotherapy could do everything and the medication wasn't necessary. And I've come to realize that sometimes the psychotherapy works better with the help of some medications, if I'm allowed to speak to which kind. Sometimes what we hear of as labeled as antidepressants often help people be able to change their thinking patterns with anxiety. So if you are thinking about medications for your area, but so correct me if I'm wrong, but when people say, okay, I'm willing to try medications for anxiety, what's going to calm their body down? I still have a little concern about that because of the potential for getting habituated, your body getting kind of dependent on the kind of medications that calm the body down. I'm thinking the benzodiazepines.
Right.
So,
right, and I think that everybody has heard of a number of the select serotonin reuptake inhibitors, the SSRIs. And we know that they're extremely effective for dealing with things like obsessive compulsive disorder, with anxiety, and with depression. And
This is Prozac, Lexapro, Celexa, those.
yeah, so, and I think that always we look at what has been around for a long time. And these medicines definitely have been around and used in kids for a long time. One of the longest studied drugs and the effects on kids is actually Prozac. And I think, I know people get very concerned about medications, but there have been lots and lots and lots of studies that have looked at the effectiveness, appropriate doses for things like Jim was just saying, Prozac, Lexapro, Celexa, and Zoloft. Paxil used to be one of the medicines that was prescribed, and because of liver involvement, has definitely been not recommended for pediatric use. Things like Ativan and Valium are not things that I commonly or hardly ever prescribe. I think that when we're looking at a chemical imbalance in the brain, the select serotonin reuptake inhibitors and then some of the other medicines definitely can help balance out the brain's response. And those are not addictive, they are not habit forming, and can be used safely for a long time. Things like Valium and Ativan and Xanax are extremely habit forming. The detox from having an addiction to these is extremely long and difficult, and definitely not something that I'm willing to take with my kids. I think that I have a few autistic kids that just absolutely freak out when they go to the doctors, and so we use it in very controlled situations, but to use it long-term is not a viable option.
Thanks.
Yeah.
So I'm going to be saying more things about treatment at the end, but I want to give Eunice a little more time to chime in about her approach.
As I'm listening to all of this,